And then when we go into lateral rotation of the tibia with bringing that hip back into neutral, we are now having slack at the proximal attachment and we have tension at the distal attachment. And while we're resting, let's continue with our nerve gliding exercise demonstration. And now I'm going to be showing you a nerve gliding exercise to help release tension on the saphenous nerve. A few days ago, I showed you guys how to perform the prone saphenous nerve tension test. And this is going to allow us to release some tension on the saphenous nerve. So if you do happen to have any type, if you scored positive on any of the tests or are experiencing any of the symptoms, this would be the exercise you would want to perform. First thing that we want to do is get into a standing position, and we could be up against a wall, holding onto a chair. I have the massage table right over here all set up already, so I'm just going to be leaning up against the massage table. But first thing that we want to do is take the knee of the affected limb into maximum knee flexion. And then from this position, the first thing that we want to do is extend the hip backward 3 to 5 repetitions while maintaining that maximum knee flexion, and ask ourselves, are my symptoms getting better, worse, or are they staying the same? Or are they staying the same? If your symptoms are either getting worse or staying the same, we would immediately stop with the exercise. There is no need to continue. We don't want to exacerbate your symptoms. However, if you have noticed an immediate improvement in your symptoms, what we would do is keep that knee in maximum flexion, and then we would do 20 repetitions of hip extension. Let's say you've done the maximum knee flexion and hip extension, and you still haven't noticed a reproduction of your symptoms. What we could do from here is we could go ahead and we could go into a lateral rotation of the tibia. So we would go ahead and we would point those toes out toward the outside for 3 repetitions. After 3 to 5 repetitions, once again, we are going to check in with ourselves and we want to ask ourselves, have my symptoms gotten better, worse, or have they stayed the same? If you've noticed that your symptoms have either gotten worse or stayed the same, we would immediately stop because we don't want to exacerbate your symptoms. However, if you have noticed that your symptoms have immediately improved, we're going to maintain that maximum knee flexion, go into hip extension, and then do 20 additional repetitions of lateral rotation or external rotation of the tibia by turning those toes outward. That is if we want to gradually build tension from proximal to distal. A couple of different options. Another thing that we could do is turn it into more of a gliding technique by taking tension at one end and slack at the other end. So we would want to build tension while the opposite end is releasing the tension. And then that way we can get a little bit more of a gliding motion of the nerve. I'm going to show you what I mean by that. This test basically has 2 components to it. After we have the setup position of maximum knee flexion, there's a component of hip extension that builds tension proximally, and there is a component of lateral rotation of the tibia that builds tension distally. So what we would want to do is, as we are building tension at one end, we would want to release tension at the other end by doing the opposite of what the motion is intended to do. So when we go into hip extension, we would want to go into medial rotation of the tibia. And then as we go into lateral rotation of the tibia, we would want to take the hip into flexion by bringing it forward. So we're going extension medial rotation, flexion lateral rotation. When we go into extension with medial rotation, we have maximum tension at the proximal attachment and we're releasing tension at the distal attachment. And then when we go into lateral rotation of the tibia with bringing that hip back into neutral, we are now having slack at the proximal attachment and we have tension at the distal attachment. Those are a few of the different ways in which we could play around with this exercise to help release tension on the saphenous nerve. So if you're experiencing any of the typical symptoms like pain along either the medial compartment of the leg or the thigh, or also tingling in the midfoot, that is one of the times when you could give this exercise a try. And the one thing that you want to do is 3 to 5 repetitions once you feel the symptoms, and then you want to check if everything got better, worse, or stayed the same. If it got worse or stayed the same, stop so you don't aggravate your symptoms. If it got better, continue to perform 20 additional repetitions. During the next rest period, I'm going to be taking you through a nerve gliding exercise to help release tension on the tibial nerve. But for right now, our rest period is up. It is time for set number 6. That was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.